Welcome, and congratulations on taking the first steps toward a healthier new you. The Johns Hopkins Center for Bariatric Surgery is located at Johns Hopkins Bayview Medical Center in Baltimore, Maryland. Our center is recognized by the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program as a comprehensive center with adolescent qualifications. This prestigious designation acknowledges our overall commitment to patient care, safety, and excellent surgical outcomes. Our team prides itself on superior long-term success, and we track our patients closely for life. The overall goal of our program is to help each patient achieve improved overall health and add quality of years to their life. This information session will provide background information on bariatric surgery, the procedures we offer, the process for insurance approval, and your overall journey leading up to and following your surgery. We strongly believe that getting as much education and knowledge as you can before your surgery will be the key to your success. You may find it helpful to take notes during this presentation, or write down any questions you have to bring along with you to your first appointment. Let's begin. What causes obesity? Obesity can be the result of a number of things. There usually are genetic factors involved. Environmental, cultural, psychological, and/or socioeconomic factors also commonly play into becoming obese. What are the available treatment options? For both obesity and obesity-related conditions, healthy eating habits and exercise are always the first recommended weight loss method. There also are medications, behavioral modifications, and finally, as we'll discuss now, the surgical management of obesity, known as bariatric surgery. Why do we do bariatric surgery? The purpose is to alleviate or eliminate obesity-related medical diseases. It is not cosmetic surgery, and patients still may be overweight at the end of their surgery. Patients also may plateau from weight loss. However, the goal of bariatric surgery is not to become skinny, it's to become healthy. Are you a candidate for bariatric surgery? According to the National Institutes of Health, bariatric surgery candidates must have a body mass index of greater than 40, or a body mass index of greater than 35, plus obesity-related conditions. Obesity-related conditions may include type 2 diabetes, high blood pressure, high cholesterol, heart disease, or others. We'll further discuss those as well as body mass index in a moment. Candidates must have previously failed attempts at weight reduction. They should have no recent substance abuse. They should not be using nicotine or smoking. Candidates also must realize that bariatric surgery is a lifelong commitment to lifestyle and dietary changes, as well as follow-up. Throughout the bariatric surgery process, it's very important to have realistic expectations, as well as a strong support system of family and friends. What is body mass index? Body mass index, or BMI, is a measure of body fat based on height and weight that applies to adult men and women. It's measured by your weight in kilograms divided by your height in meters squared. If you look at this chart, you'll see that morbid obesity means a BMI of greater than or equal to 40, or excess body weight of greater than 100 pounds. Superobesity means a BMI of greater than or equal to 50, or excess body weight of greater than 150 pounds. How do we measure excess body weight? Here's an example. If you presently weigh 250 pounds, you subtract your ideal body weight from this. In this case, the patient's ideal body weight is 150 pounds, so excess body weight is 100 pounds. If we were to tell you that you could lose 50 to 75% of your 100 pounds of excess body weight, you would lose 50 to 75 pounds. What are obesity-related conditions? There are many conditions that can be caused by obesity. The most common include heart disease, diabetes, high blood pressure, sleep apnea, joint pain or osteoarthritis, gallbladder disease, reflux or GERD, blood clots, or even cancer. Breast and colon cancer have been associated with obesity. Let's move on to the laparoscopic sleeve gastrectomy. This is also a restrictive procedure. In this case, part of your stomach is removed, but laparoscopic techniques minimize discomfort and recovery time. This diagram shows how part of the stomach is removed. That's approximately 2/3 to 3/4 of your stomach. And what you're left with is a new stomach pouch. It's shaped like a banana, and in fact, it's about the size of a banana. It holds approximately 75 to 125 cc's, which is equal to about a half a cup. The laparoscopic sleeve gastrectomy does not involve any intestinal rearrangement. The small bowel is neither cut nor rearranged. What are the benefits of the laparoscopic sleeve gastrectomy? There is no malabsorption. The sleeve gastrectomy preserves the pylorus, which decreases the risk of dumping syndrome. We'll further discuss dumping syndrome when we talk about gastric bypass surgery. Patients undergoing this procedure will lose 40 to 60% of their excess body weight in the first 2 years following surgery, which is a higher average rate of weight loss compared to the adjustable gastric band. What are the risks? The stomach may stretch over time. If you start to eat more, you can imagine what would happen to the small stomach. In the sleeve gastrectomy, a large portion of the stomach is removed. It cannot be replaced later. Other risks include a possible leak, stricture, or chronic GERD. The last surgical option we'll discuss today is a restrictive and malabsorptive procedure called gastric bypass. If you follow the diagram, you'll see the food you eat normally moves into the distal stomach. We discussed the pylorus earlier. The pylorus sits below the distal stomach and is like a gatekeeper muscle that allows food to move from the stomach into the small intestine. In the small intestine, the liver and the pancreas relieve chemicals to help you digest your food as it moves into the small bowel. This is the natural pathway for food digestion. In the gastric bypass, your stomach is divided. The distal stomach never sees food again. It stays in your body, but no longer will be part of your digestive tract. Your new stomach is a small gastric pouch. It's about the size of an egg. Part of the small bowel is brought up to connect to the gastric pouch. Now when you eat healthy food, it fills up the gastric pouch and then goes directly to the small bowel. The food then moves down the small bowel, bypassing the liver and pancreas fluid used for digestion. This procedure creates malabsorption, since food digestion occurs further down in the small bowel. The procedure also creates restriction, since fewer calories can be eaten due to the small size of the gastric pouch. When we spoke earlier about the pylorus, we noted that in the sleeve gastrectomy procedure, the pylorus was maintained. In the gastric bypass procedure, the pylorus is bypassed. Food moves directly into the small bowel. The small bowel does not like a high concentration of sugary or fatty foods. Therefore, when someone who has had the gastric bypass procedure eats those kinds of foods and they go directly into the small bowel, it results in what's known as dumping syndrome. Symptoms of dumping syndrome can include abdominal pain, nausea, vomiting, heart palpitations, redness in the face, and an overall sense of not feeling well. Most patients undergoing gastric bypass will lose 60 to 75% of their excess body weight and maintain this long term. A study was featured in a 2007 New England Journal of Medicine showing long-term mortality after gastric bypass surgery. During the study, researchers followed 7,925 morbidly obese patients who had gastric bypass surgery and 7,925 morbidly obese patients who did not. After 7 years, there was a 40% decrease in the rate of death in those who had gastric bypass surgery, meaning they were living longer. This was due to a decrease in heart disease, diabetes, and cancer among the surgery patients, meaning they were getting healthier. What are the benefits of gastric bypass surgery? We know it's been proven that patients lose 60 to 75% of their excess body weight within 2 years of gastric bypass surgery. It's also been proven that patients see a reduction of obesity-related conditions after gastric bypass surgery. There's a low risk of death if this procedure is carried out by an experienced team, such as ours. What are the risks? Marginal ulcers are one, as well as stomal stenosis. You'll be asked not to smoke after surgery, as well as leading up to your surgery. Smoking increases the risk of ulcer formation, as well as poor wound healing. Other things to avoid include non-steroidal anti-inflammatory medications such as ibuprofen. We also ask that you limit the amount of alcohol you use. Avoiding these things will decrease the risk of ulcers or inflammation in the gastric pouch and small bowel. If your doctor prescribes aspirin therapy, you should consider antacid therapy along with it. Another negative associated with gastric bypass surgery may be iron deficiency anemia or calcium deficiency. If you fail to take the vitamins you'll be asked to take, you can be particularly prone to deficiencies. Gastric bypass also is a difficult procedure to reverse. There is a risk of infection, a leak, or a bowel obstruction. Finally, we discussed dumping syndrome, which can occur in those who have had gastric bypass after eating sugary or fatty foods. If you do not eat properly following gastric bypass, dumping syndrome may occur frequently. Let's again discuss some of the operative risks for any of the surgical procedures we've discussed today. The first risk is leakage of stomach fluid from any staple line. Secondly, stricture or blockage. Ulcers are a risk, as we discussed. Bleeding may occur and require a blood transfusion, although this occurs in less than 1% of patients. Blood clots are a risk, which is why it's important for patients to get up and move right after surgery. Heart attack and stroke may occur. If you're at risk for either of these, please discuss the surgery with your primary care provider or cardiologist. Anesthesia is a risk. And, as with any surgery, death. To decrease your risk for complications, closely follow the instructions you're given leading up to and following your surgery. At the Johns Hopkins Center for Bariatric Surgery, we've looked at the outcomes of about 1,000 of our patients after surgery. Over the course of 1 year following gastric bypass, about 73% of these patients had resolved their high blood pressure. About 75% had resolved their diabetes, and 91% had resolved their acid reflux or GERD, and about 93% had resolved their sleep apnea. This chart shows weight loss in these same 1,000 patients over the course of 5 years following gastric bypass surgery. In this time frame, these patients lost an average of about 65% of their excess body weight. Patients undergoing the laparoscopic sleeve gastrectomy will be discharged 1 or 2 days after surgery. Gastric bypass patients normally are in the hospital for 2 days after the procedure. Upon returning home, you'll be asked to take vitamins to help your body adjust, including a multivitamin, calcium citrate with vitamin D, iron for menstruating women, and vitamin B12. If you have your gallbladder, you'll also be asked to take a medication to decrease the risk of gallstones, which frequently can occur during rapid weight loss. A dietitian will review all of this information with you before your surgery. During the first week after surgery, you'll be on a full liquid diet. During the second, third, and fourth weeks after surgery, you'll be on a pureed diet. These diets are high in protein, and water intake is very important. Again, a dietitian will review all of this information with you before your surgery. It's also important that you not lift anything over 15 pounds in the first month following your surgery. Women should avoid pregnancy for at least 18 months after surgery. We've discussed in depth each of the procedures offered at the Johns Hopkins Center for Bariatric Surgery. Now, let's discuss where to go from here in preparation for your first appointment with one of our surgeons and how to begin your journey to bariatric surgery. The first step you'll need to take to prepare for meeting with a surgeon is to contact your insurance company and make sure bariatric surgery is covered in your health insurance plan. If it is, you'll need to then find out what plan-specific requirements are needed for bariatric surgery. We recommend you do this in writing. You should also note that if your insurance changes at any time between now and your surgery, you'll need to reconfirm your insurance coverage and requirements. If this happens, you'll also need to alert our office. The next step is to complete the health history assessment you'll be given after watching this video. You'll then need to mail, email, or fax it to our office. Your health history will be reviewed by our surgeons, and you'll be contacted by our office to make your first appointment with our team. At your consultation appointment, you'll meet the bariatric surgery team. We'll review your medical history with you. Please bring any pertinent medical records with you. We'll discuss your surgical options. Finally, you'll receive a patient resource guide to assist you with the requirements for bariatric surgery and outline the next steps. We also recommend you bring a support person with you to your first appointment, as well as any follow-up appointments. This person can help keep you on track and support you along the way. After your first consultation appointment, you'll begin working on the requirements you'll need to meet before having surgery. Insurance requirements and the requirements of our program typically include a visit to your primary care physician, which includes obtaining a letter of medical necessity for surgery, a supervised 3 to 7 month weight loss management program with a registered dietitian or primary care physician. This may be scheduled at Johns Hopkins Bayview Medical Center. Attendance at our bariatric surgery support group meetings, which are held at Johns Hopkins Bayview Medical Center. Call 410-550-0409 or visit our website for details. Bariatric nutrition education at Johns Hopkins Bayview Medical Center, a psychological assessment. And finally, standard preoperative labs and clearance to receive anesthesia. Our multidisciplinary team includes medical office coordinators, program administrators, a database coordinator, a research coordinator, dietitians, psychologists, nurses, nurse practitioners, and surgeons. They'll be helping you through every step of your journey. Our clinical staff members are experts in their fields and dedicate their time to caring for bariatric surgery patients.
Our surgeons are Doctors Gina Adralis, Elisa Coker, Thomas Magnuson, Hin Nguyen, Michael Schweitzer, and Brenda Zosa.
Here are some pictures of our bariatric surgery patient rooms. These rooms are dedicated to bariatric surgery patients and are specially equipped to make patients comfortable throughout their hospital stay. Patients and their families are cared for by a medical team that specializes in bariatric surgery. We encourage you to continue educating yourself on bariatric surgery. Please read and do research to understand the lifestyle changes necessary for your success. If you have any questions at any time, please call us at 410-550-0409. You've completed our online information session. Follow the next steps on this web page to complete and submit your health history and request an appointment with one of our bariatric surgeons. We thank you for your interest in our program and look forward to meeting you soon.